I'm a medical officer for Hospital Selayang, and it is my pleasure to present my study titled Prevalence of Appendiceal Neoplasm, a single-center retrospective experience. I have nothing to disclose from my study. Appendectomy remains one of the most commonly performed emergency surgical procedures worldwide. While it is routine, occasionally HPE examination may reveal concealed appendiceal neoplasm. Based on the latest systemic review of literature done in 2017, the global reported prevalence of incidental appendiceal neoplasm ranges between 0.9 to 1.4%. However, there is limited Southeast Asian data, and particularly in Malaysia, there has not been a large-scale published audit study to date. Hence, my study aims to bridge this gap with local data to help provide insight into the incidence, different HPE subtypes, and their clinical management. The objectives of my studies were, firstly, to identify the incidence of appendiceal neoplasms in appendectomy, secondly, to describe the different HPE subtypes of appendiceal neoplasms and their clinical challenges, and lastly, to determine the rate of white appendix in Hospital Selayang. This was a retrospective audit study conducted in Hospital Selayang over a period of 4 years from January 2021 to March of 2025. The inclusion criteria includes all patients who underwent appendectomy, and data was collected via electronic medical records (BHIS) system. The key variables collected here was demographic details, operative approach, intraoperative diagnosis, and final HPE diagnosis. So let's go into the results of my studies. This shows the demographic of my patients. We had a cohort number of 750 patients who underwent appendectomy. This table shows the distribution of cases across age group and gender. We found that 60% of our patients were males, with the highest incidence occurring in young adults between the ages of 21 to 30 years old. For the ages of below 10 years old, only made up of 7% of cases, and ages 71 years old and above showed less than 2% of cases. 2/3 of our operation was done via laparoscopic approach, of which had a conversion rate of 15.1%. This actually highlights the increasing reliance on minimally invasive techniques. Our conversion rate of 15.1%, it is a relatively small conversion rate as compared to global data, which is 10 to 15%. Even though our rate of 15% is on the upper limit, but Hospital Selayang actually serves as a training ground for aspiring surgeons, and it may be attributed to case complexity as well. So next, let's look at this table. This table highlights our intraoperative suspected diagnosis versus their final HPE diagnosis. So here, each row shows us the final HPE diagnosis and can be further divided into 4 categories. Firstly, complicated appendicitis, simple appendicitis, normal appendix, and appendiceal neoplasms. While each column shows us the suspected intraoperative diagnosis. In our study, we detected 6 cases of appendiceal neoplasm out of 715 cases, which brings us to a percentage of 0.83%. This aligns with global rates of 0.9 to 1.4%. And we'd like to highlight here that actually we suspected 6 cases to be appendiceal neoplasm. However, only 1 turned out to be true. And this diagnosis was further aided by a preoperative CT done. Conversely, out of 405 intraoperative diagnosis of simple appendicitis, 5 of them actually turned out to be appendiceal neoplasm. So actually what we want to highlight here is there is a clinical challenge to diagnose appendiceal neoplasm intraoperatively. Next, we look at our third objective, which is to identify the rates of white appendix in Hospital Selayang. There were a total of 70 cases out of 715, which were proven to be HPE normal appendix. This is a rate of 9.79% based on a recent meta-analysis done for global rates of white appendix in 2023 Our global rates puts us at between 4 to 20%. Hence, this is an acceptable rate. It is important to monitor the rates of white appendix in your hospital to gauge diagnosis accuracy. Lastly, let's look at each of these individual cases of the 6 appendiceal neoplasm. So the subtypes of appendiceal neoplasms found in my studies were low-grade appendiceal mucinous neoplasm, or in short LAMN, neuroendocrine tumors, and low-grade dysplasia. Out of the 6 patients, 3 of them were found to be LAMN. The first case being a simple LAMN with clear margin, hence appendectomy sufficed for the patient and he was discharged. The second case being a LAMN with involved margins. After appendectomy, surveillance was done via CT and colonoscopy. CT revealed pericecal lymph node, however, patient reported planned colonoscopy. And this is the last case which we successfully diagnosed as intraoperative suspected neoplasm, which HPE confirmed to be true. So for this patient, she actually had a preoperative CT done, which showed a cystic mass in the right iliac fossa with peritoneal nodules. Hence, she was suspected to have appendiceal neoplasm with pseudomyxoma peritoneae and was decided for diagnostic laparoscopy. Intraoperatively, we noted a tumor at the tip of the appendix with multiple peritoneal nodules with a PCI index of 23. Postoperatively follow-up, HPE revealed involvement of the entire appendix, hence she was decided for chemotherapy. However, patient was unable to complete chemotherapy and hence decided for palliative intention. Next, 2 out of the 6 cases were neuroendocrine tumors, of which both tumor sizes were less than 2 cm and low Ki indexes. So for the first case, she was done surveillance with a post-op CT, which revealed lesion in the lungs and the liver. Unfortunately, patient defaulted follow-up and could not complete colonoscopy as baseline. The second case was actually a gynae on-table referral for us for a routine appendectomy for a right ovarian tumor. And post-operatively, we did a surveillance colonoscopy, which showed a sigmoid polyp, and HPE showed the inflammatory cells. Lastly, it's a case of low-grade dysplasia. Patient underwent appendectomy, post-operatively did a colonoscopy, which showed a polyp in the appendiceal lumen. HPE of the polyp showed inflammatory changes and subsequently was discharged. So the limitation of my study is conducted in a single center study. So we recommend that it should, for future studies, should be done in a multi-center study with preferably larger sample size and longer period of study to further validate our findings. To conclude, the prevalence rate of incidental appendiceal neoplasms in my center was 0.83%, which aligns with global reported prevalence. Routine HPE examination should be done for all appendectomy cases, and it is difficult to establish intraoperative diagnosis of appendiceal neoplasms. Clinical management should be tailored depending on different HPE subtypes of appendiceal neoplasm. So for future improvements, we suggest a pooling of nationwide appendicular HPE data to determine the true epidemiology of appendiceal neoplasms in Malaysia. Thank you.